Good afternoon. My name is Sylvia Shelton. My topic of discussion today is xenotransplantation and my position is against it. To begin, I will go over what xenotransplantation is. It is different from the more commonly known allotransplantation, which is when a donor and the recipient of tissue or an organ are of the same species, such as a human heart that is transplanted into another human. Allotransplantation was not common until the 1960s, when improved surgical techniques and immunosuppressive drug regimens resulted in better outcomes. But today, we are debating xenotransplantation, which is when a tissue or organ from an animal of one species is implanted into an animal of another species. It is also known as a cross-species transplant, such as when a heart from a baboon is transplanted into a human. Doctors began experimenting with xenotransplantation in the early 1900s. They would try to replace failing organs in humans with those from pigs, goats, lambs, or monkeys. All of the experiments failed, however, because the human immune system attacked the organs and caused transplant rejection. In 1944, Peter Medawar, shown on the right, discovered that tissue or organs that were transplanted caused an immune response where the immune system recognizes the transplanted tissue or organ as foreign and attacks them. This causes a rejection, and there are three different types. There is hyperacute rejection, where the rejection is rapid and occurs before the surgery is even completed. There is also an acute rejection, where the rejection occurs within the first few weeks or months after the surgery. Then there is a chronic rejection, where the rejection occurs gradually over several years. There are three types of xenotransplantation. The first is animal cellular therapy. This is where cells from an animal are transplanted or implanted into a human patient in order to compensate for a deficiency in the human's own cells. For example, insulin-producing cells from the pancreas of a pig are transplanted into a suitable site in the body of the human patient with type 1 or insulin-dependent diabetes. The pig cells produce insulin and can eliminate the need for future insulin injections. The second type is animal external therapy. This occurs ex vivo, or outside the body, when cells or fluid from a human patient are filtered or cultured with an animal cell and then returned back to the human patient. For example, liver cells from a pig are placed into chambers of an external device along with the blood from a human patient that is filtered. The blood is then transfused back into the patient and can help stabilize the patient until they can receive a liver from a donor. The third type is animal organ transplant. This is when an entire organ, such as a heart, or tissue, such as skin, from an animal are transplanted or implanted into a human patient. For example, a kidney from a pig is transplanted into a human with kidney failure. Here I have put together a timeline of some of the significant experiments with xenotransplantation. One of the first to experiment with xenotransplantation was Dr. Keith Reemtsma in Tulane, New Orleans in 1963. He attempted to transplant 13 chimpanzee kidneys into 13 human patients. 12 of the patients survived for 9 to 60 days. One of the patients survived for 9 months. Dr. Thomas Starzl, pictured below, in 1964 at the University of Colorado, transplanted 6 baboon kidneys into 6 human patients. The average survival rate of those patients was 19 to 98 days, but most of the patients died from infections. Also in 1964, Dr. James Hardy at the University of Mississippi transplanted a chimpanzee heart into a 68-year-old semi-comatose male patient. The patient only survived 2 hours because the heart was too small to support his circulatory system. In 1977, Dr. Christian Bernard, who performed the first allotransplantation of a human heart in 1967, transplanted a baboon heart and a chimpanzee heart into 2 human patients who had unsuccessful open heart surgery. The baboon heart lasted 6 hours, and the chimpanzee heart lasted 4 days until it was rejected. In 1984, one of the more well-known trials of xenotransplantation, Dr. Leonard Bailey transplanted a baboon heart into baby Faye. She was born with a poorly developed left side of her heart. She survived 20 days after the surgery. Some believe her death was caused by an incompatible blood type with the baboon. Here we can see a picture of her post-surgery. In 1992, now at the University of Pittsburgh, Dr. Starzl transplanted a baboon kidney into a patient with AIDS and hepatitis B. He believed baboons were resistant to hepatitis B. The patient survived 70 days with no signs of rejection. His death was caused by an infection his body could not fight off due to heavy immunosuppression. In 1999, in archived blood and tissue samples, they discovered the kidney contained baboon cytomegalovirus, which is what caused his death. In 1993, Dr. Starzl transplanted a baboon liver into a hepatitis B patient. The patient never awoke from the surgery, and he halted his program to further his research on transplant rejection. So we can see a trend that most of these trials had initial success, but all of the patients ended up dying within a year. By 1995, more researchers began to get more involved with xenotransplantation. In 1995, scientists at Diacrin Incorporated received FDA approval to begin clinical trials to use fetal pig neurons to treat patients with Parkinson's disease. Phase 1 trials showed no safety problems and led to Phase 2 trials later on in the 90s. In May of 1995, scientists from NextTrend developed transgenic pig hearts that survived 30 hours inside a baboon, compared to the 60 to 90-minute survival time for regular pig hearts. And the FDA approved the use of transgenic pig livers as bridge organs on up to 10 human patients. In 1997, Professor Robin Weiss discovers PERV, or porcine endogenous retroviruses, that are embedded in every pig cell. He discovered each pig cell carried 50 copies of the PERV, and that up to 3 of those can infect human cells. The FDA halts all clinical trials of xenotransplantation until researchers can prove they are able to detect low levels of PERV. The moratorium is lifted in January of 1998. In 1999, the FDA bans all use of non-human primates in human xenotransplantation due to the risk of cross-species infections. This shifts the focus from using mainly non-human primates to using pigs for xenotransplantation. In the year 2000, the International Society for Heart and Lung Transplantation issues a report advising an end to clinical trials until the minimum viral risk is determined, and 60% of pig organs survive in non-human primates for a minimum of 3 months. In March of 2001, Phase 2 controlled trials treating patients with Parkinson's disease with injected pig neural cells showed some improvements. However, there was no difference in improvement between those who received actual pig cells and those who received a placebo. Non-human primates were used primarily at first because of similarities to humans and a believed reduced risk of immune rejection. They are thought to have a greater capacity for suffering than other animals because of their level of self-awareness, their need for social interaction, and they have a greater sensitivity to pain and distress. The problem was that they could actually easily transfer infections to humans, so pigs were now the focus. In this diagram, we can see the organs from a pig that can help humans with illnesses or disease. On the left, in orange, we have the transplant trials that could possibly have imminent success, such as pancreatic islets to treat diabetes, brain cells to treat Parkinson's and Huntington's disease, red blood cells for blood transfusions, and eye tissue such as the cornea. On the right, in red, we have the transplant trials that are still several years away, such as transplants of whole hearts, kidneys, livers, small bowels, and lungs. Some of the problems or concerns raised by xenotransplantation include the fact that some question, is it acceptable to breed and kill animals to provide organs for humans? Some believe evolution has no direction and is unpredictable, so they feel xenotransplantation is like playing God. Another concern is how would the organ allocation lists differ? Once xenotransplantation is more common, there would be 2 different lists, one for human donors and one for animal donors. So who would oversee these 2 lists and ensure everyone received fair treatment? And then once there were 2 different lists, what kind of effect would this have on the number of people who are organ donors? If they know there is an alternative, would the number decrease? Another concern is, what limits are we willing to go to in order to delay death or to improve our quality of life, and who determines when enough is enough? Some of the religious concerns include the fact that Buddhists generally don't accept it because they believe all living things should be treated equally, and Hindus oppose all transplantations because they believe the body must remain whole in order to pass on to the next life. On the other hand, Judaism, Christianity, and Islamic religions generally don't oppose xenotransplantation if a human life is at stake. Some of the cultural concerns include, how does the person feel about having an animal organ in their body? Some would feel like they were less human. Some believe there is more to the human being than the body, such as the spirit. There is also the belief that the mixing of species is unnatural, and it disturbs the balance of nature. Some socioeconomic concerns include The fact that xenotransplantation costs more than a regular transplantation because of additional costs for the animal, where they must be bred, fed, housed, euthanized, and their body must be disposed of after the transplant. For the human, they must be monitored post-procedure, they must have an autopsy performed, and their body must be quarantined due to the possibility of cross-species infections. Xenotransplantation will rise annual transplant costs from $3 billion to $20.3 billion in an already overburdened healthcare system. Also, physical contact may need to be limited not only with loved ones, but the general public due to the risk of transmitting infections. And if money is being spent on this type of research, is that taking away from money that could be used to research alternatives? Some of the risks involved include, is it worth the trauma and recovery? Although some of the patients were able to sustain life for a short period of time, they inevitably died within a year of the transplant. The longest a patient lived was 9 months, but the majority of the patients only survived days after the transplant, especially baby Faye. If I were her parents, I would have just taken my child home and spent as much time with her as I could, instead of putting her through that trauma and having her in the hospital attached to all those machines. Another risk is to the patient's overall health. In an otherwise healthy patient, xenotransplantation alone can cause their death, such as the patient who died in 1992 from an infection due to heavy immunosuppressive treatment. Then, very importantly, are these clinical trials worth the risk to the public health? The PERV and the cytomegalovirus that were spread during the experiments are only viruses we know about. What about the infections we don't know about yet? Because an infecting microbe can change when it is transmitted from its original host into a new species. In other words, a virus that normally doesn't cause a disease in its animal host can develop a serious disease or be fatal to a human transplant recipient. The virus can even remain dormant in the human and cause latent effects, where the disease or illness may not appear until later in life. So, how can we solve some of these issues? We should wait for further research to be conducted before trials on humans commence in order to allow time to find cross-species viruses. We should promote prevention of diseases and illnesses that lead to organ failure and promote more people to become organ donors. There should be more research on artificial organs or devices and research on tissue and organ engineering from human sources, such as cord blood banking. These are the references that I used for my presentation. And I chose to use a picture of Babe the pig on the first slide and this last slide in order to make you think about whether you believe it would be okay to take organs and tissue from Babe and place them inside your body or a loved one's. Thank you for your time.